Okay. I'd like to start out by just telling everybody that I don't take minutes. I simply record it, and it will be posted on our nphl.org website. So give me a day or two to get that in, and we will be able to share that with everyone. So I've been trying a little bit different on attendance. I've been making sure to try to get everybody in. And if I haven't gotten you in, if you're signing in late, please do sign in your own name and location. So I also want to ask if I think we do have several new people. Ashley King is interim from Great Plains, so I'm glad she's on. I know we have some new DHHS people, and I wonder if Sandra Dolan, if you'd introduce yourself.
Josh.
Hi, I'm Sandra Dolan. I just started DHHS about 2 weeks ago. I'm the new lead epidemiologist. I come from Florida, so I'm new to Nebraska.
Great time to come. All right, thank you. And we'll be talking leads here in a little bit. So glad to have you on. Is there anybody else new to our laboratories across Nebraska or to DHHS or to NPHL? I don't think we have anybody new at NPHL, but all right. Well, with that, we're going to go on. It's always a reminder from the EPI folks that we want to make sure and remind all laboratorians that if you are needing testing at the CDC, do give us a call, because it does need some approval, and we'll help you get started on that process. And so with that, let's go ahead and see if anybody is on for SARS reporting. Do we have Pete or Emily? Ouch. All right. Robin, we'll skip down to you. I suspect that they're just joining late. If you could share with us influenza.
Sure. So flu did go up a little bit in the last few weeks. So we need to continue to watch for those. We're still looking for any sort of influenza B PCR or molecular diagnostic test to be sent in. So please contact your local health department or us or the public health lab if you have a specimen available that has tested positive for influenza B. There just hasn't been very many, and CDC and needs some specimens to help make the new vaccine strain. And we need more information on that. Also, if you might have seen some news about avian influenza showing up in some poultry flocks kind of close to us, Indiana and Kentucky. So we just want to be on the lookout for people who potentially would work in these the poultry industry, and a lot of them would possibly be like USDA workers or community members. And if they are seeing signs of influenza and happen to work in those industries, please note that and let us know ASAP. We're trying to track all the workers, USDA is, so we'll be in contact with local health departments and labs if needed. But if you come across any unsubtypable influenza, you please contact us immediately by phone call and send that specimen into the public health lab. It could potentially be related to the avian influenza outbreak, or could possibly be a novel influenza. And it also could just be there's something happening with your test. So please keep that in mind when you do, or if you ever come across an unsubtypable in a respiratory panel. Does anybody have any questions on that?
Okay, Robin, thank you. We will backtrack now. I see Emily is on. Wondered if we could put you on the spot just to talk about the COVID numbers, hoping they're going down. And I also see Pete. So,
sorry guys, we had a meeting that ran over. I apologize on that.
that's all right.
COVID numbers testing here at the public health lab have gone down. I have heard from a couple other people that that's what they're seeing in their laboratories as well. We are continuing to sequence all positives that meet appropriate quality requirements here at the public health lab. Majority of these are still going to be the initial BA1 of the Omicron, but we have seen a couple BA2s in the past. We're keeping our eye on that and moving forward. If anyone has questions, feel free to reach out. I'm happy to help.
Emily, what nationally, what is the BA1 doing? I mean, really, are they other states experiencing the same as we, where it's international?
So nationally or internationally, you're seeing what everybody's reporting out in the media. The BA2 is more transmissible. And so it is slowly taking hold, given that we're landlocked and not a huge metropolis. You know, it just takes a little longer for things to be detected here. I foresee probably at some point in the near future to have majority of BA2s. I'm not surprised by that at all as this virus continues to mutate and develop, what we've seen historically with all variants of this COVID virus.
Yes, thank you. Good to know. All right, we'll move on. If no questions on flu or COVID or RSV, we can go on to norovirus. Who would like to speak to that?
Hey, it's Brianna. Can you hear me?
Yes, we can. Thank you.
Yeah, we're definitely still seeing norovirus in the community. You know, happening at long-term care, child care centers. Something kind of interesting we just recently saw was a hotel pool that we had 2 lab confirmed cases of noro from different groups of parties from over last weekend. It's at this point, it's still kind of hard to rule on if it was waterborne or not, or person to person, or even environmental. I still need to kind of finalize the data, but so that was kind of a different setting that we typically don't see, which was interesting. Let's see. I think that's about it for norovirus. Unless anybody has any questions. Or Sadie, you want to add anything more? Or Emily? Emily's shaking her head now. Okay.
How's your salmonella outbreaks going?
Sadie, you want to give an update on that? You've been working on those.
Which ones?
We seem to be getting a lot of salmonellas.
Okay, the local Lincoln Lancaster outbreak at a correctional facility, that's definitely died down. I think actually the onsets were pretty tight, but MPHL was just able to do a whole genome sequencing one that included a food product. It was raw mechanically separated chicken, and it came back matching the same serotype. It was 3 SNPs, was that single nucleotide polymorphisms different. I'm trying to figure out what that equals in alleles. Anybody great at algebra out there that can help me convert SNPs to alleles? But it likely is very similar to our human isolates. So once we have that, we'll probably do some kind of notes in the field and document it, just because we had a salmonella outbreak at a correctional facility 2 years ago also, and it was the same food product that was kind of implicated in the outbreak. And if you guys aren't familiar or aware of what mechanically separated chicken is, it's a type of comminuted chicken, and it comes frozen, like large 50-pound tubs. And the issue that we have with it, it's totally safe if you like thaw it and cook it right, but the issue is with these facilities is because of how large it is, a lot of times it doesn't thaw in the appropriate amount of time. Even after 3 days of thawing, it's still frozen, and then you throw it in the kettle and try to cook it, and then you still get a little bit of raw chicken in there. So that's that outbreak. Otherwise, we have a couple CDC multi-state clusters. One is a Salmonella St. Paul. And there isn't any like public information out there at this point because we're still in the hypothesis generating stage, so we don't have any suspect vehicles, but just kind of working to collect more information. We've deployed a focused hypothesis generating questionnaire with our cases. So
What's
kind of
happening?
backtracking there.
I don't know.
Was that for me?
Any questions?
Lucian, what just happened? Why were you running?
Sorry about that, Sadie.
So Sadie, it's interesting. We don't get the food isolates very often to match with a human. So that was a pretty neat case to be able to find the smoking gun.
Especially because this facility doesn't have a lot of, what do I want to say, documents in place, so we can kind of track what was used for which meals. So yeah, we definitely are feeling pretty lucky.
Yeah, good.
All right, thank you. Any other questions for Sadie or Brianna? Okay, thank you. At this point, I thought I would ask Derry if he would like to speak on lead testing for us.
Hi, I sure can. I don't
Okay.
have anything majorly prepared.
That's all right.
So, like I said, we have our new lead program, Sandra, who's on the phone or joining us, and she'll probably be taking over I kind of mentioned this, I think, on a previous call, but again, the biggest kind of update in the lead world is CDC revised and updated the blood lead reference value from 5 down to 3.5. And as a reminder, the blood lead reference value, or BLRV, is not necessarily an indicator, a toxicity threshold, but more of a measure to identify the children in the top 2.5% of their blood lead levels compared to the population. So, in other words, it's a reference value to show which children have high blood lead levels based on their peers in their population. And so on the lab side, I think that impact should be fairly low, although I know with NPHL, and then when we look at like reference labs out of the state, when we look at the clinical interpretation notes or comments on the result, it's always been kind of, some of these like Mayo, LabCorp might be referencing old values, and so just take note of if things get referred out to out of state lab like LabCorp or whatever, to their clinical notes might be not the same, might be outdated, and the other important thing, I guess, related to that is how we interpret that, and how we take that new value and interpret that new value at the state level. So, I believe Douglas County went and made the switch right away. We kind of voted at the statewide level in December, and we're currently updating like our medical management guidelines to say, hey, what should doctors be prescribe, or what schedule should they be retesting if it's elevated. And so we're updating those now, and updating documents for what local health departments should do with this new level. And so those will be kind of coming out as we get them done, and those will be shared with when we get those done with a health alert. So those are kind of important things that if you have questions, contact myself or Sandra about that new level. And the other issue or interesting thing with is in the lead world is this lead care recall. The test kits have been recalled, and that has moved a lot of testing from point of care to kind of reference labs. I heard someone chatted on a Zoom call that the recall that maybe ended, or in other words, there might be supply of test kits for those point of care devices coming up soon. So so in the next couple of weeks maybe, or now, I'm not quite for sure, but that's been something that has impacted the lead world about the inability to do point of care testing. So we'll have to see what happens, but that's kind of the update there. So
Gary, thank you for sharing that with us despite no warning. But I do know that when you are finalizing, or once everything is finalized, that you are working on an article that we will share with the whole lab community. So, but only when everything is finalized, certainly. All right. Any questions on lead testing? Okay, hearing none. I thought I'd bring up the topic of the a baby formula being contaminated. This has gotten some huge press lately. The FDA definitely has shared a lot of information with us, even the names of the companies at this point. So I have shared here on our agenda the link in which you can see that information in full. I believe that we've also put out a lab alert to ask our laboratorians, if you do microbiology or blood cultures, anything of the sort, if you do see any of the Coronobacter species, please let us know, and please let us bank it, or actually we would like to sequence it. So we would ask that you would send this organism in. That's kind of an interesting article. Emily, Pete, anybody from DHHS like to speak to this?
It's Brianna from DHHS. FDA did update 2 days ago to include Salmonella as well, Salmonella Newport. So right now, as of 2 days ago, it said 3 complaints of Coronobacter and 1 report of Salmonella Newport in infants. Right. And that actually just this morning, I got a call from South Dakota. They had received a stool sample that's currently pending at their lab, but it's on a Nebraska resident that the doctor believes they could be part of this recall. The mom did check the website and said the lot code matched. We don't know of any blood or spinal fluid that was collected. I believe the baby's a 5-month-old. Just, diarrhea, fuzziness, not eating as normal right now. But they did return the products back to the store, so we don't have the product to collect to test. So we'll see what the stool sample comes back as, if it does turn up as salmonella or not. But just FYI.
Yeah, we
Does
should.
Go ahead.
We should be getting all the salmonellas sent to us for sequencing. So hopefully we won't miss any of the salmonellas. Chronobacter sakazakii, however, would not be something we'd normally get in the lab for sequencing. So in any case, you know, if you know a child or it's a child that's on, you know, powdered infant formula that gets that infection, those isolates are the ones we want sent to us. So just kind of keep that in mind.
So Brianna, a question I have in regards to this whole issue. How is it that baby formula across 3 different companies would be contaminated? Do they share maybe a basic base product that they might buy from one common manufacturer? How does that work?
Yes.
I like that.
To be honest, I haven't read in detail about you know, the common ingredients that's shared among all 3 companies or brands.
Well, hey, Brianna, hold on. This is Brian. I think the company is Abbott, and I think it's 3 brands of Abbott product, and they're all manufactured in a single plant in Sturgis, Michigan, is where they're concerned about.
Okay.
What they need to answer when they come to it.
Yes, that makes total sense. So,
And just to add a little bit more, there's been a fair amount of testing that's been done in the plant, and they have not identified either the Chronobacter or Salmonella Newport in the facility. I think there might still be some testing involved with product, and I think any state that would have any cases that are connected, if there's any way to get product, it would be worthwhile to be able to test it. So hopefully more testing will be done.
Thank you, Brian, for adding that. I haven't had time to read the full press release, just kind of bits and pieces so far, but yeah.
No worries. I know you're working on a lot of things, so that's why
Yeah.
that's why I pulled it up, just because I figured we'd get questions on it. So you're good. Thanks.
Yeah, thank you.
Yeah, the press release I'm just looking at now says that they conducted routine testing for Chronobacter and other pathogens at a plant in Sturgis, Michigan, and found evidence of Chronobacter sakazaki in a plant in non-product contact areas. They have not found any
Interesting.
Salmonella Newport. And then they're talking about there were 4 consumer complaints related to this. So, you know, it seems like it's a pretty limited number of cases that's been seen.
yeah.
So that's what they got. That's on their website anyway.
All right. So everyone beware. Thank you for that information. We can move on then to, and let me quickly bring up a topic of Haemophilus influenza. Allison, I think you were the one who introduced this at our last meeting. Am I correct? And I just wonder, or was it Robin? I apologize if I'm wrong.
No, it was me.
Okay, would you be willing to go into that in detail?
Yeah, sure. So there's been an update to the invasive Haemophilus influenza recommendations in the 2021 edition of the Red Book. So currently, we prophylax household contacts of cases of invasive Haemophilus influenza B if the household has a child younger than 4 years or has a child that's immunocompromised. And now they are recommending that same prophylaxis be done also for invasive Haemophilus influenza A, because they're showing that Haemophilus influenza A can cause just as severe disease as Haemophilus influenza B. Now I'm guessing that most labs don't test for A. They probably are doing B, non-B. Is that a safe assumption?
That's a good question, Allison. I also think that there's a number of laboratories who have dropped that kind of serial grouping simply because of the cost, but I'd like to open it up to our laboratories to see if anybody continues to do this testing. Emily, were you going to say something? Please.
Nope,
please
I was
go.
going to say that exact thing was that it's my understanding that most laboratories have dropped this. Yeah, I know that we had talked about putting it out on a questionnaire from NPHL to see if there are any laboratories still performing this assay in the state of Nebraska. I don't know if we've gotten around to that yet, but I do also know that this is something you can't even send out to AREP for instance. They don't even perform it themselves. So maybe these changes in the guidelines will cause this testing to come back.
We do have on CAT a number of laboratories, Great Plains, Bryan, and Methodist say they do not do that testing. So there are some larger hospitals that don't. Definitely something to keep an eye out for. Thank you.
I suspect it's going to be looked at in more detail. We do get Haemophilus influenza, the non-pneumonia, the systemic isolates sent to us, and we do send them to a reference lab for serotyping. I don't know how much serotyping they're doing at this moment. I know they're looking for Bs, but that might be something we could check into, Emily, to see if they're actually looking at A as well.
Okay. All right.
So it would be a specialty lab that would be doing it, I'm sure.
Yeah. So Pete, what is the thought here that laboratories that do isolate Haemophilus influenza in sterile body sites, I believe, is on our list to send to NPHL? We just want to remind everyone to please do that, even though they don't serotype, but is there anything we can add?
No, keep sending those to us.
Yeah, all right.
And we work with the reference lab then for testing.
Yeah. All right. Any questions about Haemophilus influenza? Hearing none, I'm going to go on and just share for my microbiology labs that with the upcoming LPX and challenge sets in April, that BT media, I think one of the lots is expired at the beginning of this month. Because of short staffing and motility media not arriving here at NPHL, we are going to test our QC. Actually, we have, and I will send out an official notice that we're extending that expiration date. So be on the watch out for that. If you don't have any media at all, let me know. Otherwise, as soon as we can get motility made, we will go ahead and ship that out to all of our microbiology labs. Before I get into biosafety tip of the month, I want to add one thing here. And I don't know if Paul Williams is still on. Is there anything from client services that we should talk about? Don't hear anything from Paul. He might be off the hook for a little bit. Anybody else from Brian, Lance, anything that you can think of on your end?
Just a couple things. I think the TB interferon testing is a reportable test, and we are going to begin our annual screening of the healthcare employees with the Department of Corrections. So whoever watches that may see a blip in testing, but it's just annual testing for the quantiferon test. and that will finish up in June. I believe it's May through June of this year. On another note, our client services department is having a hard time keeping an adequate stock of the BD EDTA tubes, either K2 or K3, in sizes 2, 3, or 4 mil. So if anyone has excess capacity and they would like to share some with us, client services would be happy to receive those. We do have a supply of EDTA tubes that are from the supplier Griner, if anyone's familiar with them. And these are adequate tubes, however, they do not fit our main instrument without some type of redesign, and that probably won't happen. So I do have EDTA tubes that I could exchange if Griner tubes would fit your instrumentation. So if anyone can help and drop us an email, that would be great. You can email me. My email is blenz@unmc.edu. Thank you.
Thank you, Brian. Hey, any questions for client services? Biosafety tip of the month, just because we've been talking about avian strains. I know that it is of low probability, but I thought I might just pique some interest and ask, what precautions would you take if you knew that there were some human cases pop up in the United States? Even before it hits Nebraska, would you consider dusting off your pan flu procedures? What else could be done in the laboratory? Well, think about it. Think about working with the specimen. If you're not working with it under the biosafety cabinet, that's certainly a recommendation, just like we did for COVID. I think this would even be more so important for the safety of our laboratorians. So, and I'm going to move on to packaging and shipping. Excuse me, I have an image here down at the bottom. I just thought I'd share and see if anybody can tell me what's wrong with this picture. Let's see if I can't enlarge for you. So you're welcome to throw it into chat, or you're welcome to unmute and just see who, besides anybody at NPHL, who could share with me what is wrong with this particular package. It would be rejected by FedEx. Actually, we've had it rejected before, so we've learned. All right, somebody give it a good guess. Looking at the wording. So that makes me think that there is packaging and shipping classes coming up that I will be holding on March 21st and 23rd. It is a full 8-hour day, or divided into 2 days, but you will be certified to ship at least for category A and dry ice. It is also helpful that even if all you do is category B, it would be helpful to know how to classify what is category B and what is not category B. So if you're not sure about what this package is, Dan says it doesn't say what category it is. And that is somewhat true. It's not it is true, But DOT purposely does not say category A. So the point with this label is that the newest labels for category A, which you only know by UN 2814, infectious substances affecting humans, it no longer has the wording underneath that says, in case of damage or leakage, immediately notify public health authority. And then here it's got the CDC phone number. Well, in the last probably 5-7 years now, they discontinued this label simply because this is a label that is used globally. So they did not want people internationally calling the CDC. I believe all it says at this point is just call your public health authority, and it does not have the CDC label. So good try. And thank you, Dan, for chiming in there. I also see in regards to open mic that there's been some discussion in regards to, as I read along here, is this water testing, tracking COVID-like illnesses in ED visits? Brian, I don't know if you want to share anything more with that. Oh, this is for the surveillance, right? And
Yeah,
also,
I can
sorry,
probably speak.
I was having a little trouble. Derry, let me
Sure.
handle that one first. I was having a little trouble getting unmuted. Sorry. So I was talking about syndromic surveillance, where we look at ED visits, and we have a system that can process the chief complaint data and have some definitions where we can differentiate COVID-like illness from influenza-like illness with some relative degree of accuracy. So even if people are coming into the health system and emergency department and maybe we aren't getting a diagnosis with a positive test, we can at least see those spikes in the numbers of visits, and then that would really prompt us to start investigating. So that was for ED visits, and then Derry, I'll let you talk a little bit about wastewater surveillance. Thanks.
Yeah, thanks, Brian. Yeah, there's a question about wastewater surveillance and testing for SARS-CoV-2. The answer is, yeah, I think there was an article too that was just published in the Omaha World Herald. But yeah, CDC has a wastewater surveillance system that Nebraska is now a part of. We haven't started reporting our data, and we just started collecting some samples from a few locations. But we are then growing. I think our goal is to have at least one wastewater facility, community wastewater facility in each local health department jurisdiction that will be testing, sampling at least once a week for SARS-CoV-2. In that way, it'll be good. One of the most important or useful purposes for the wastewater surveillance is when cases are low, and we might be able to detect regional patterns or increases in shifts and trends. So we'll be doing that. More data to come. Our data is we're still kind of in development of the surveillance data, development mode of kind of setting everything up, but we are starting to do those sampling, and we do have two sites in Omaha, one site in Lincoln, and we're adding a couple, about 5 to 10 more sites here in the next couple of weeks. And then
Derry,
we'll be,
who's doing the testing? Who's doing the laboratory testing?
Mike Wiley's group.
He's doing all of it?
Yeah.
Okay.
As of right now.
So what is the goal if you do find it? What are you going to do? What kind of surveillance are you going to do with the people?
So this is just monitoring community levels. So
Yeah. So if you find it in wastewater in a community, do you have a program in place to actually do spot testing of individuals in that community?
no, so when I say community, I mean the entire, city. So, so as of now, like if testing results now, it's detected very unsurprisingly, it's we're detected when we're basically looking at a pooled sample of the entire city of Omaha. We can detect it. So I think the important thing is looking at the trends, whether the trend is increasing or the trend is decreasing or static. And that's what CDC has wastewater surveillance data on their COVID tracker. They added it, and that's the main indicator. Which of these sites or communities have increasing wastewater, static, or decreasing wastewater concentrations, normalized concentrations. And in terms of interventions, what happens if a local county or jurisdiction, we're at low levels and we start seeing a rise in wastewater surveillance? That is an opportunity for intervention, or using that information to complement other systems to make informed decisions. I think we don't have any sort of specific, this happens here with wastewater data, then you need to do this. I think it'll be up to the local health department jurisdictions to use that information to supplement what they already know, to help understand what trends we have for.
Is there a committee or a group of people who are discussing how this program is going to work in Nebraska?
So we have our kind of our work group among our university partners with the Mike Wiley's group and UNL, who's doing the working with the wastewater facilities. So we have.
Derry, what I might suggest is you get these people together, include the public health lab, and we can discuss this further. We work with Mike Wiley a lot too. He's on the UNMC campus. And he had questions about the program. It's called the National Wastewater Surveillance System, right?
Yep,
I think there's things that we, for instance, the public health lab can help in this program as well, that we need to have discussed. I don't know where the funding's coming from. Is this a new program that's being funded by the state?
It's coming from ELC, and I'm happy to talk to you offline about this. Yeah.
Well, okay. I'd like to know more about what's going on, because I think we can be helpful in this program as well.
Certainly, would love your keeping you in the loop and
sure
input.
Okay, thanks.
Yeah.
I had a quick question. So do people excrete the virus before they're symptomatic? So would this wastewater be an early indicator of COVID trends? Does anybody know?
Dana. They do have it in the stool.
Before they're symptomatic.
People can have high titers of virus.
Okay, that's interesting.
Yeah.
And Dana, I believe your initial question, first of all, was missing a new variant in the at-home test, and then whether or not we could pick it up in wastewater. It's very tricky to find a new variant in wastewater just because of the pure volume of different strains of COVID that are present. You're literally looking for a needle in the haystack. What you can do with wastewater is overall percentages. Is this predominantly Omicron? Is this predominantly Delta? Those kind of trends. It's very difficult to find single strains or single variants. Yeah, it's like I said, it's like finding a needle in the haystack, but you don't know what the needle looks like.
Yeah,
right. That makes sense. But that's where population surveillance would come in, is if you had like a small community that were positive for COVID in their wastewater, then you would want to go and do population testing to see if you could pick up and figure out what's going on.
Yeah, I think people are just going to rely at these at-home tests and probably not go to their doctors. So we won't be seeing samples as much and finding those variants. So.
Yeah, you're right.
But thanks for the responses. That was helpful.
Anna, thank you for bringing that up. Interesting topic. And like to open up and see if there's anything else, any topic that we could help our laboratories with. Are there any burning questions out there that we can discuss? We have a
Hey,
few
Karen,
more minutes.
this is Brian again. You know, I would add that if people are being hospitalized or having relatively severe illness, it's going to be important to try to confirm a diagnosis on such people, and if they had at-home testing done, hopefully we'd be getting a repeat test with a with a PCR. So we're trying to do pretty extensive surveillance around hospitalized cases and obviously deaths or any of these adverse outcomes, and even clusters in the community in institutional settings and group settings. So that's kind of where we're pivoting to be spending most of our effort at the state on where we'd like to see investigations, and we will continue to really try to get some robust testing around those situations. Thanks.
Okay, thank you, Brian. Any other questions or comments? I did want to bring up one. I skipped under packaging and shipping the comments about temperature monitoring. We will save that for next time, but I'd like you all at the laboratories to kind of do some research into what CLIA or what other accreditation regulations you have. Look to see what they have for temperature monitoring of specimens during shipment. We'll share the story with you next time. And then the other thing is just in regards to New Alert, just to remind everyone that New Alert is not just for COVID. It does allow you to order anything from NPHL. So please use it if at all possible. Our instructions are listed there on the front page of our website. So for those of you who possibly signed in later, do check the chat to make sure your name's on it. I have been typing a couple in, but if I missed you, please go ahead and add your name and facility. If no more questions, I'm going to just remind everyone that our next meeting will be Monday, March 21st. Sorry, we had to move it till Tuesday this month, but we will try to get back into the swing of things of Monday. And if you have any overwhelming comments about Monday being really tough to join this meeting, let me know if it is a problem. I would like to hear that. So, last chance for questions. All right. Thank you, everyone, for your time. And if any staff members are interested, this will be recorded and placed on our website. Take care and have a great week. Bye-bye now.
Thanks, Karen. Bye.
Yes. Bye-bye.